Hello, this presentation is about poor circulation, primarily in the legs. This is not something that you commonly hear about, but it is an extremely important condition to know about as it has a direct effect on your health and well-being. So I say, attention please. So what exactly are the risk factors for poor circulation? High BP is one, so is diabetes, high cholesterol, smoking or tobacco use in any form or shape, obesity, heart disease, stroke, advanced age, and certain other factors. So any one or more of these factors, if you have them, will put you at a higher risk than average for having poor circulation. Let's first look at the image on the left hand side of this slide, the image of a man. You can see in this image the blood circulation to various parts of the body, and this is called the arterial circulation. This is basically the oxygen and nutrient rich blood that is going to various tissues and organs in the body. Okay, now do you remember plaque? We've talked about this in our topics about heart disease, stroke, and some others. Briefly, plaque is the fatty cholesterol rich material that typically starts building up in inside the arteries or the blood vessels over a period of time with when there are one or more of the risk factors that we've discussed earlier, such as high cholesterol or diabetes or high BP and so on. Now you have to keep in mind that this plaque buildup does not happen overnight. It starts at an early age, and as long as the risk factors are present and are not well controlled, it'll be an ongoing process and slowly will start blocking the artery. You can see in the picture on top a normal artery with normal flow, and on the bottom you see the same artery with plaque buildup causing an obstruction to the flow. In this image we are seeing an artery taken from the leg, a piece of an artery. On the left hand side the image shows a normal artery with blood flow flowing smoothly, and on the right hand side the same artery now with plaque buildup causing the blood flow to significantly reduce. Keep in mind that when we talk about plaque, this plaque can build up in any one of the arteries in the body. The most sensitive organs are of course the brain, because plaque buildup here can lead to a stroke. In the heart, the same plaque building up in the heart blood vessels can lead to a heart attack, and if it were to happen in the kidneys might stop functioning normally, eventually leading to kidney failure. And here we are talking about this plaque building up in the blood vessels of the legs, leading to poor circulation. What is poor circulation exactly? It's also known as peripheral artery disease, or PAD for short. The arteries going into the lower limbs are involved in PAD. The plaque that we were talking about just a few minutes ago, it starts causing blockage to the blood flow. And the more risk factors you have, the stronger the possibility and the faster the plaque buildup. This unfortunately can lead to amputation of the leg or legs if it is not identified and treated at the right time. Also, once you have a diagnosis of PAD, you will need to be worked up, or your physician will need to evaluate for other blockages such as in the heart, brain, kidneys, etc. Because plaque, if it's building up in the arteries of your legs, there is a good possibility that the same plaque is also causing blockages in the blood flow to the other organs, because the risk factors are essentially the same. So PAD is very strongly associated with heart disease, stroke, kidney disease, and so on. What are the symptoms of PAD or peripheral artery disease? Most commonly noticed symptom is an aching pain, sort of like a toothache kind of a pain it can be in the buttocks, in the thighs or calf muscles. The blockages can be on one or both sides, so the pain too can be on one or both sides. Typically, in the early stages, walking or any sort of exercise activity, climbing stairs, will bring on this pain, and it is relieved by resting for some time. If the disease is fairly advanced and severe, symptoms can even be present at rest, meaning that pain is constant and is not relieved by anything. So if you have these symptoms, if you think you have these symptoms and you have risk factors, you should consult your physician right away. You're wondering, I have some risk factors, I do have some symptoms that we've just discussed. How do I know if I have this condition or not? What you will need to do first off is go see your doctor, talk about your symptoms and the risk factors that you think you may have. And your doctor should of course do a thorough physical examination, check your pulses, check your legs, your blood pressure, order some basic tests, and then order this test called an ankle brachial index or ABI to diagnose peripheral artery disease. It's a fairly simple, straightforward, painless test. What the technician will do is check your blood pressure in both the ankles and both arms with a special instrument called a Doppler probe, and then calculate this value called ABI, which for us to say is normal, should be between 0.9 and 1.2, and if it's less than 0.9, we say it's abnormal. And obviously, the lower the level, the more severe the disease. It's quite important for you to remember this fact that you have to get the test done in a well-reputed diagnostic center so you get the most accurate report. Now, let's say you got the test done and it is abnormal. What do you do now? First of all, it's very important that you understand what your risk factors are for developing this condition. Your blood pressure, if you have high BP, your diabetes, if you have this condition, if you have high cholesterol, they all need to be under excellent control. Change your lifestyle for the better. Extremely important to help avoid any serious complications. Regular exercise is an absolute necessity if you have this condition. And make sure that you take the medicines prescribed by your doctor. And keep in mind also that even with medicines, if your lifestyle does not change, they will not work and improve your circulation. If you are a smoker, you have to stop smoking immediately. Smoking is the worst thing you can do when you have this condition called peripheral artery disease. And this also goes for people who use other forms of tobacco in the form of pan masala or gutka and so on. So as I mentioned earlier, if you do not take care of your risk factors and if you do not control them well, this condition will definitely worsen. Also, as we've discussed earlier in this presentation, PAD, the presence of it, means that you may have blockages or plaque buildup in other arteries, let's say arteries that are supplying blood to your brain or to your heart or your kidneys or other organs. So that puts you at a very high risk for heart attack or a stroke or other health conditions. And what procedures are typically done when this condition is advanced? So, as I just mentioned, for severe peripheral artery disease, surgical procedures may become necessary. Angioplasty or bypass surgery are the two surgeries that are usually done. And you heard it right. And if you can remember, the same procedures are done for heart disease, for blockages to the heart muscle. If you have coronary artery disease, it's basically the same procedures that are done for those arteries also, but of course in a different location. Sometimes emergency surgery might become necessary if the blood flow is completely cut off to the leg, and unfortunately in some cases amputation of the leg may also become necessary. This is it for this condition called peripheral artery disease. You may have understood some of the issues and you may not have understood some other issues regarding this condition. So I think the one advice I'd like to give you is that you go through this presentation one more time so you get some clarity regarding this condition, understand the risk factors, and do what you need to do to take care of it properly. Thanks for watching.